Okay, everybody. So, welcome. So, this evening we have a very special guest tonight. We have Dr. Sebastian Lomas, aka Seb. He is here to share with us all of his insights from a dentistry perspective. So Seb is a biological dentist who I actually was I saw him for the first time during the summer, actually speaking at our European convention. And if I'm totally honest, I hadn't considered myself somebody that would have signed up to do a class on dentistry, or it wouldn't have been something that I would have considered myself to have an interest in. But just because I was having a treatment done during the summer, I just thought I'd listen in and learn. And my mind was blown about the connection that our teeth have with all of these different areas, functions, body systems, and ultimately how we feel day to day. So I really enjoyed it, and I was just like, oh my gosh, I'd love to be able to share this message with my wider community. So I hunted him down, for lack of a better phrase, and I asked him if he would kindly come in and um, if he'd kindly come in and share his insights, his wisdom from industry, um, with us all this evening. Um, so that's it. What I'm going to do is I have a list of about 20 questions that I got through from you all. If you have any additional questions that are coming through, if you're joining us live from the interactive Zoom, please pop them into the chat. If you're watching over on Facebook, add them into Facebook. We're going to start with our questions that we have here, and if we have time at the end, we'll go through the chat and start to answer some questions. So let's get cracking. Sebastian, welcome.
Oh,
Um,
thank you. I'm actually so happy to be here. Honestly, it's an honor no matter what and who I speak to about dentistry, because I just think more of us need to be more aware, right, at the end of the day. So
yeah,
thank you for having me. I really appreciate it.
not at all. It's my pleasure. Just before we continue on, what I'm going to just ask is for everyone just to make sure they're on mute, just so there's no interference. If I can just let me see if you're not on mute already. Yeah, great. Appreciate it. Okay, so I'm going to just start into the questions, and the first question is something that's, really basic, but just trying to get an understanding for somebody that's brand new, and I would consider myself a beginner learning about the teeth and oral health and dentistry. First of all, if you can share a little bit about what biological dentistry actually is.
Uh, well, I call it next level dentistry. That's my brand tag for it. But it's essentially taking everything into account. And holistic dentistry was the original term back in. Well, it still is, and it's still the most searched term, and that's how most of my patients do find me. But I think I'm trying to move away from the term holistic dentistry into biological dentistry, just because of the PR that the holistic dentistry had in the field, where it's not scientific, it's woo woo, and a bit like the essential oils and how people poo poo that from the medical community. So biological dentistry to me is really using the research that's out there, just like doTERRA's, and what it can be used for that's not the norm in the current way of thinking. And unfortunately, or fortunately, however you look at it, in the UK and Northern Ireland, I guess we're around the NHS and the health system, and actually for anything to become a common practice in the health system, usually it takes 18 years from first discovery and research for it to come out and be practiced as standard. And that's just all the bureaucracy around it and how long it takes to get there. So even though the treatments that I offer my patients, like you would say that there's less science to prove them, it's newer technology, and we're using things that haven't been trialed before. So for example, if someone has gum disease, it wouldn't just be, oh, clean them off with a scale and polish thing and go away and brush your teeth better. It would be looking at the mouth breathing so you don't dry your saliva out enough. It would be taking pressure off of the teeth, because clenching and grinding causes pockets within the teeth. It would be using low-level infrared light therapy within the gums to help balance the bacteria. It would be using things like, there's a brand called Biocidin which we use, and it's like they're very similar to doTERRA. So now I've integrated, this was prior to the mouthwash being released, so now I integrate the doTERRA mouthwash into it to balance the bacteria, not kill good bacteria as well as bad bacteria. And then even using things like ozone and water and things that, you know, just go above and beyond what you should be doing, but you're looking at not should be doing what the conventional does, to try and get to the root cause. Because there's so, and I even go as far as genetic testing with some of my patients, because they might just have that inflammatory nature, right? And if they have an inflammatory nature, we're going back to the doTERRA pyramid, and you need to get your lifestyle right and eat less of those inflammatory foods or take more lifelong vitality. So it's actually, you know, holistic sums it up. It's the person and looking at every factor. And I'm quite lucky coming into the field now that there's been lots of trials and error with lots of different things over the years. So I'm picking up now being like, oh, we've got 5 things for gum disease now, whereas 10 years ago or 15 years ago, we probably had 2. So for me, the success rate is much, much higher. And people that have been told, no, you're going to lose your teeth, or, oh, that's got to be lost, you know, it's completely different. And for me, it's very magical to be able to offer these alternatives, just like for everyone else that has the essential oils and no one's heard of them. And you open their mind to that, right?
Yeah, absolutely. And it's great to know that there is like another dimension when it comes to supporting your wellness,
Mm.
and knowing that there's various different styles of treatment and various different practitioners that can offer that. And like that, I would have considered myself somebody who'd been quite, well versed when it comes to alternative or holistic wellness and health. And then when I heard, and I wouldn't have ever considered or heard of biological or holistic dentistry. And then when I watched your panel at convention, I was just like, oh my gosh, like we really haven't scratched the surface, when it comes to understanding the body and the different ways that we can support it. So it's just fascinating. So when did essential oils come kind of like weave its way into your practice or into your clinic?
Through my wife's nose.
Okay.
And it was maybe like 2016, 17, I think. And maybe late 20, somewhere around maybe late 2017, 18, around that time, we went to the Yoga show in Manchester. And um, I was actually dragged there. I love yoga, but I was like, not sure I could watch football or do whatever I do that I don't even do nowadays, which is so funny. And while we were walking around, and my wife was like, what's that smell? What's that smell? And of course, what it was the orange and peppermint, the ultimate. And as soon as I saw my wife do it and her nose running, her eyes open, I was like, oh, give me this, let me try it. And anyway, so we went to an online class on the back of that, and I was the one that got the bug, because I was like, this is science, this is research, let me go and do it. Give me a bottle, let me see the reference, and let me go to Aromatic Plant Research Centre, let me type in the batch number, let me go and look at all the compounds. Is this how it works? And then I spent like probably, my wife got a kit straight away after that call, and then I just spent 6 months researching it, and then I just became amazed by it. And then it was me that fell in love with using them clinically. And at that time, I couldn't really use them clinically because I was in the NHS still. So I used them like aroma, from the aroma side, aromatically, that's the word I'm looking for. But that was it. And then now my whole clinic is just oils everywhere. So I've even got like this, what's the word? Mural on my side of my where my dental chair is, which is just a woodland, and obviously I'm just diffusing balance all the time and giving the patients balance in the chair. So yeah, it's just
Gorgeous.
fantastic.
So is that something that you typically do? Is it for somebody who'd be a nervous patient coming in, or?
It is, I'm always diffusing either adaptive or frankincense or balance, but if someone's really nervous, and it's quite common for a lot of my patients to have been traumatized by dentistry in general, and then expect the same thing. So we have to break that trauma pattern, which is, break's the wrong word, ease them out of it, and get them to a place that's, and it's always the first appointment. And I've had 12-year-olds crying in my chair about needles for an hour and not done anything, but the next time they've built up the confidence, and I've just been trying to work them through it and using the oils and giving them those trigger points, and when they come back they can do it. And to me, that's not an hour wasted, that's an hour gained, because that person's going to look after their teeth for the rest of their life, whereas before they might have neglected it because they're so scared, so worried about it. And the oils are a beautiful tool for people that are hugely anxious. So I diffuse all day, but people that are really anxious, it's frankincense on the wrists and inhaling before we do any treatment, or balance, depending if it's a man or woman a lot of the time.
Yeah. That's incredible. Even what you're saying about children, like I definitely like those are my childhood memories, going to the dentist and having fear and going to school and feeling sick in school all day and I know my own family, there's a lot of fear around dentists and even some of the questions that came through that I've to ask you, you know, are people that have had treatments and like that, they you know they lost their trust really and I think you said about breaking the trauma but it really is so knowing that you can use your oils and it's something that I would do when I'm going into the dentist anyway. I would use some oils just to help calm myself and ground myself, but it would be so supportive to know that walking in that you're getting that and right throughout your treatment, you know. So okay. So let me see. So I have, yeah, so actually you just answered my first question, which was what would you say to anyone that's a nervous patient? You kind of answered that, but is there anything else that you could recommend to somebody who is a nervous patient in general when it comes to dentist visits?
I think like a Zoom call like this with the practitioner is really helpful. Like people that are super phobics are really hard work because they probably won't even come to chair. But I've had a few phobic patients, and you know, my thing is using as least chemicals as possible to help with them. So even the anesthetic I use in the dental chair is one without adrenaline in it, because you know how much that races your heart and causes problems, right? And the gold standard is one that has 1 in 80,000 units of adrenaline in there, which is quite a lot, especially for a female, a lot more. And that's why a lot of the women patients, when I was in the NHS, because I couldn't even get my hands on the other one, would have panic attacks, and you know, just in the chair, just from the anesthetic. So using with phobia, seeing someone that knows, and it's the rapport, isn't it? So if you can build up a communication line like this and keep it open, and I try and respond on all kind of platforms from all different people, and even I don't mind my reception team booking out, you know, over my lunch period Zoom calls for people that are super nervous, and that for me is the biggest thing. So if you're nervous about something, try and get to know the person that's going to be doing the treatment and what they're like, because you're intuitive, you'll instantly know they're the right person. You know, I have people message me just voice notes on, or I always message and voice notes back, because you can hear the tone, that you get the feel for it. And I have people just saying, oh, I know you're the person, they just come, and you know, that's just from me and my voice. And so for a video call is even more powerful. And if you're worried, ask if anyone can do that with you, because that will rest the nerves. And obviously use oils everywhere, and frankincense for me, and balance, frankincense under the tongue and balance on the wrists, and inhaling it is like my ultimate when someone's super nervous.
Yeah, so it's good to know that even just before we go in. And then so all the questions they don't flow, and I'm just gonna read them out. And there's no like rhyme or rhythm to them. But the first question, or the next question I should say rather, is about women who are approaching those menopause years and their bone density is getting weaker, and all the different body changes, the chemistry changes that are happening. You know, is there an impact that that bone density change has a knock-on effect on the teeth, and if so, how do you support that?
I mean, the good news about our head and neck is that it's got one of the highest like vascular rates. There's so much arteries and veins draining and toing and froing, and that in turn means that they get good blood supply, good nutrients, because a lot of the bone density comes from the veins and arteries are getting smaller and becoming more constricted, so the nutrients, the blood supply, everything else is less. So that's why they say, especially even to my grandparents who are in their 80s and 90s, you know, just walk around, do a bit of exercise, just walk, because you're getting the blood flow going to these places, and bone is constantly remodeling. In kids, it's like every 3 months or less. So you can influence so many things when you're younger, but as you get older, your skeleton is replaced every 8 years or something. But in your face, it's about 9 months. So all these jaw bones about 9 months. So as long as you're not using your jaw in a detrimental way, such as like clenching on the teeth all the time or grinding them, which is causing bone density to be weaker in the places you're putting pressure on it. If I was constantly going like this and pushing my teeth down, the bone under here is going to be weaker because it's going like that all the time. But it's actually not so much of a problem in the mouth, which is interesting because we have a ligament support system as well. All the teeth are held in by tiny little ligaments. So it's like a compression system. So unless you're chronically grinding your teeth or got advanced gum disease, normally the bone's pretty good and you don't normally break your jawbone very often because of bone density. But going through the menopause is such an interesting time. My patients are more hypersensitive, so you have to be more calming with them, even more sensitive to anesthetics as well. And it's the bone density is not so much of a thing for me in the mouth, which is good news. But things like gum disease, for example, do flare up. It's a bit like when you're pregnant in a way, because the hormones are surging in a different way and things are reducing. So you just have to be more vigilant, more careful. But there's no reason it should inhibit anything. You know, I've patients I think I had to take one tooth out on someone a few months ago, and she was 86, and it was her first molar that came in, you know, the ones that the kids come in at 6 years old, and she got to 86. And I said, that's amazing. You think about, you've had that tooth in your mouth for 80 years, you know, and you've gone and done it the best way. You split it right in half. So I have no idea what you're doing.
But you actually touched on something really interesting there, but just about grinding teeth, because there is a lot of tension out there with with the way the world is at the moment. A lot of people are tense, stress levels are elevated. Are you seeing that more patients are having, are experiencing that tension in their jaw, grinding their teeth at night, that sort of thing?
It's really hard to know because I guess the practice that I work at kind of specialize in it. So I'm not seeing the true population remit because a lot, and I kind of specialize in it myself. So for me, I even pick up the smallest signs of it. So then for me, like I pick it up and mention it to a lot of people. But I guess the question for me would be, are there lots of people that need treatment for it? And I suppose I go for optimum health. So I treat everyone for it, but it's depending on how long that takes to undo what's happened over the course of a lifetime. But 100%, all the new patients, the existing patients that have been with us, not new patients I haven't known yet, are definitely requiring more of that than they would have been where they were previously stabilized. So yeah, it's a really interesting point.
Yeah. And another thing that you mentioned as well is just around when we're talking about hormones, is around, women that are in pregnancy. And there's all the different things that happen in pregnancy. So like bleeding gums, women that are, have a lot of morning sickness, that are maybe vomiting, all the acidity is like weakening their teeth. And there's all these different things that you're aware of. And somebody mentioned as well that like the shape, I think, are your teeth more inclined to move easier because of the prolactin. Everything is just a bit looser. Is there anything that you can share with women that are pregnant, how to support their teeth throughout pregnancy?
Yeah, you've got to be super on top of oral hygiene because so interestingly, we did a saliva genetic test with one of my patients that was pregnant, and everything was heightened, and it's really interesting because you would have expected it. This is one person, so it's not the rule for everyone, but from the standard, if someone gets a little bit of plaque caught in a bit of a tooth and they haven't cleaned it for a day or two, and they get this massive epulus, which just is like a bubble next to the gum, and you wouldn't get that if you weren't pregnant a lot of the time. And you think, well, why is the immune system heightened in these areas? Because obviously it's doing more, I guess, because my theory is that it's trying to keep everything out of the way of the baby growing and saying, right, you get out, no, nothing in here, while we focus on giving all of our energy. But at the same time, I think about that and I think, but it's using a lot of energy to fight these things off, and then the baby's growing. So it must be, but anyway, that's just me and my thoughts. So in terms of, religious oral hygiene, but that's not just anything, because for me, I know you watch the convention, oil pulling is like the ultimate reduction in bacteria, balancing of bacteria with coconut oil and On Guard, or I use thyme, or I use oregano in one drop.
Would you mind, just for anyone that's not familiar with oil pulling, just kind of walking through what that process is, why you do it, and elaborating a little bit?
going back to what I said earlier with the balance of bacteria in your mouth, you want a nice relationship, more good than bad bacteria, so it's not causing disease or has less potential to cause disease. And oil pulling is a great way of balancing that, because it's a coconut oil, any coconut oil. You can even use a fractionated coconut oil. I prefer the shop bought, like, raw organic cold pressed, and you just put a teaspoon in, and it's because it has more of the fatty chains in it, so it's got the more of antibacterial and antifungal activity in there. And then you just pop it in your mouth and pop one drop of whatever essential oil you want in, and swish it around for 20 minutes is the ultimate. And then what we do is, you've got it, so it's really good for everything else in your mouth as well, because you're using your tongue to push it in places through the teeth and suck it through the teeth. So you're kind of going like this, right? And you just do it. The first week or two you do it, you're gonna have really achy everything, to be honest with you, tongue, cheeks, lips, throat, but that's fine. It's just using the muscles that you're not used to using that much. And then you spit it into the bin, and I use mouthwash afterwards to help get rid of it and balance it. But it's about balancing the microbiome, because it creates a negative environment for the bad bacteria to live, but the good to thrive. And all the essential oils you use with it aren't like bactericidal ones that kill everything. They're just, again, helping. That's the beauty about oils, because we're using it in that such low concentration. There's so many compounds within them. It actually it's not like an antibiotic. It's not that strong, it's just providing enough for your body to bring things back into balance.
And what did you mention? Sorry, I interrupted you. Actually, you were saying that your oils that you use when it comes to oil pulling are thyme,
Yeah,
oregano.
thyme, oregano, on guard, and they're the balancing ones for bacteria. And then if I'm feeling vain and I want to whiten my teeth, it'll be like wild orange or peppermint. Those two together
Yeah,
usually.
yeah, wild orange. I didn't realize. Yeah, that's good, so good to know about for the whitening.
Yes, it's got really high limonene, which actually pulls all of the things out of the teeth, so it's quite a good one.
Yeah, so good to know. I heard clove as well. I've heard of clove in the past, which has been, which I think of clove as quite hot, if you
Yeah.
think of that on its own. So it's good to know that you can use something that's so much more milder, like wild orange. Um, and then let me see. So then another question is, how can we go against preventing receding gums? So as we age, those receding gums, um, or what's
Tough
the
one.
phrase, being long in the tooth is
Yeah, it's really interesting,
hard to
right?
avoid.
So it depends what's causing it. So typically, long in the tooth is a phrase for gum disease, because and here's the really interesting thing, that gum disease is actually your body destroying itself in a way, because it's trying to attack the plaque and the calculus that's stuck in the ligament space between the tooth and the bone. And your bone and your body says, I need to attack this and help. So it goes boom, 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 boom. And it fires and kills all these bacteria, but then it kills all the bone as well. And then your gums recede a little bit. It's a very, very slow process over many, many years. Now, there's a few things that can exacerbate that. Number one is if you're clenching or grinding on your teeth, because it's putting pressure on those ligaments already. The ligaments say, I need to relax a little bit here. And when they relax a little bit, more of the stuff can come in, because our mouth is like, in the surgical world, you have like a clean environment, a clean, contaminated, and contaminated. And when you operate in the mouth, it's a contaminated environment, because there's so much bacteria that lives in there. Whereas if you're operating within someone's body, that they're normally clean, contaminated, or clean. So it's like, even in the medical world, it's classed as a contaminated world. So we've got to try and bring that into balance. And there's so many ways of doing it. But yeah, gum disease, long in the tooth, clenching and grinding exacerbates it. And then it's other things that influence the factor and the rate of which gum disease can progress. And that's the body's own ability to, or wanting to be reactive to everything, and being like overworking and quite, I need to destroy this, rather than, I'm passive. And it depends how your guards in your body work. And that changes as you change your genetic makeup from epigenetics, like when you're eating good food and express different genes, and your body's not as reactive, you're not as inflamed, and X, Y, and Z. But for me, the biggest thing is putting pressure on the teeth and having bad bacteria living in the mouth. And the bad bacteria can also be because you've got metals in the mouth, because you've got root canals in the mouth that bad bacteria can live in, or because you've got the mercury amalgam fillings in the mouth as well. Because if you think about that, all of those things, they're not used in the body, they attract bacteria and fungus. And so when they're attracted, they breed more, and then they lower the good bacteria count. So then there's higher risk and more likelihood of bad things happening in the mouth. It's all about managing risk and minimizing it as much as you can. But even simple things like breathing through your mouth, because when you breathe through your mouth, you dry your saliva out. Your saliva is what remineralizes your teeth, and that's what washes away all the bad bacteria and has your immune cells in it. So it's hugely multifactorial. But yeah, for me the
Such a
biggest
good
thing is clenching.
reminder.
Yeah,
Breathing through your nose, it's until you realize the downside of not doing that you're like, oh my gosh,
I
I'm gonna
know.
make a conscious effort now. And there were two things that you just mentioned there. I'm sorry to ask again, but just
Oh,
around
wow.
the clenching, I'm just all of a sudden I'm now like, oh my gosh, just making sure that we even have, a solution when it comes to clenching. I remember seeing, I think it was, I can't remember who exactly, but they recommended doing like some sort of I think it was to do with pregnancy and hypnobirthing. And because the jaw, there's like a link between like the jaw and the pelvis, I think,
Yes, there
when it
is.
comes,
Yeah, yeah,
yeah.
yeah, yeah.
And it was actually one of the ladies in this community. I don't know if she's watching now, but Anne, and she's talking about like rolling, getting neroli and doing a massage around your jaw to loosen out your jaw, support your pelvis when it came to birth. And I just thought that was fascinating. So, do you have any recommendations just when it comes to like doing any kind of massage or treatment or exercise around the jaw to loosen out that tension that anyone might have that creates all these different problems that we may not have known about before?
It's so interesting you say that about the pelvis and the hips and the jaw, because a lot of the female patients that because I do a lot of expansion orthodontics to help people breathe properly and correctly, and training where the tongue should live and XYZ. And when we do the expansion orthodontics, the waist and the especially the ladies, that you notice, they say, I feel like my hips have got bigger since we've done this, and my back pain's less, and this one and the other. And it's just like crazy. And obviously I can't prove one way or the other, but I'm sure that will come at one point in their life. But yeah, it's absolutely fascinating that you said that as well. And I know so, because my other half, she's done exactly that. And she had teeth out when she was younger through conventional orthodontics, and had headaches, migraines, head, neck, shoulder pain, to the point where she couldn't really work. And it was all expansion and creating the gaps and putting teeth back in to give her the space that she needed. But yeah, fascinating stuff. So jaw tension, how can we help relieve it? For me, exercises are great, but obviously oils that influence blood flow. So deep blue, past tense. If you're feeling brave, you could do wintergreen. And
I was even going to say, I was like, even deep blue. I'm like, gosh, that would even, because it's quite, well, I think about deep blue going to bed, putting it up around my face. I would sometimes put it on my back, but sometimes I find that it can be quite stimulating because it's so
yeah,
strong. And I would use like black pepper, for example, instead,
yeah.
at bedtime, whereas I'd use deep blue more so during the day. And I know everyone's different. Is there any, so what were you saying, wintergreen? And
Wintergreen, past tense, but again, that's quite stimulating.
yeah,
But I actually would prefer that it was done first thing in the morning, because that's when you put pressure on your teeth, which is because at night, I'll try and explain this really quickly without going into too much detail, but there's a reason that we clench and grind our teeth, and it's all to do with our airway. And our airway is a collapsible tube at the back of our mouth. So imagine it's like that, okay? And you have this part here, which, okay, this is the front of the person, this is the back of the person. There's two factors to it that influence the space of the airway. One is your lower jaw and the structure of it, because if you have a class 2 is what we call it, where the jaw goes back like this, it means the airway is going to be a bit smaller. And then the back is the cervical spine posture, which is this here. So if someone's got a forward head posture and a small lower jaw, then it means they struggle to breathe. The last bit is the tongue, because the tongue is, you see the front of the tongue when we talk and smile and stick your tongue out, but the back of the tongue, lives in the airway. So that lives like in here attached to that lower jaw. Now, if the tongue's not living in the roof of the mouth, as you can see, look at that, that just creates a little bit of space. If the jaw is further back and if the posture is wrong, someone could potentially be collapsing their airway at night, because don't forget, when we lie back in bed, gravity takes hold as well. So you've got all of these things, but I don't know how well this is going to turn out. I'll try and demo it, but okay. If I'm breathing like this through my nose, which is what we all should be doing, right? That's fine. But look what happens when I breathe from my mouth. Hear the restriction, right? See how different that is? Now watch what happens if I try and lie back anyway. So I'm going to go with the gravity. So this is just me breathing through my nose. You can hear the same thing, but now watch what happens if my mouth's open and I'm breathing at night. You see how it shuts off? Now, the only way for me to show you that it would be clenching and grinding that would open that up again is because all of this is muscle, this muscular tube. So if I clench on my jaw, tense on my neck muscles, all of that opens. So if I'm going like this, do you see when I clench, it opens again? And that's one of the main causes of sleep disordered breathing. You've probably heard of sleep apnea, which is where someone has to wake themselves up to breathe. I would say 60% of us have some signs of sleep disordered breathing, which is the gray area that no one talks about. And that can be easily changed by either training the tongue and strengthening it to live in the roof of the mouth, bringing the jaw downwards and forwards, or wearing something to sleep in at night, and taping the mouth so the mouth doesn't open like you just heard. So these are all easy fixes. And like some of in fact, if you all want to geek out, there's a book called Breathe by James Nestor, and it's just the best book to read, to listen and read about this. And it just absolutely changed, because for me, it's the foundation of everything. If we have a good sleep, we get a restful sleep, we regenerate, we can deal with more, our detoxification is higher, everything. For me, sleep is the foundation. So, sorry, I went off on a tangent.
No, it's really interesting, and it just reinforces the importance of the things that that we think are so simple that we just overlook them, like breathing through your nose, or so no, it's really helpful. Thank you. So I might just move on and ask, what if you could walk us through like a really good oil routine for your teeth, or even like a morning routine?
Yeah. So this is going to be like controversial, because I don't brush my teeth in the morning at all.
Okay.
Never brush my teeth in the morning. I've not been doing it for maybe 2 years now. And the reason this came out is because when I realized that plaque can be beneficial as well as detrimental. So if you're looking after your oral health, you're eating all the right high fibrous foods, you've got good mineral nutrients going into your system, then that plaque, and you're not mouth breathing, that plaque is going to be remineralizing your teeth, because it's healthy, good bacteria. It takes minerals from your saliva and puts it on the teeth. So it doesn't mean I don't do anything in the morning. I do. I get up in the morning, I brush my tongue, because your tongue's got like lots of little fur on the top of it. The best way is if you've got a cat or dog, you'll know when they lick you, it's like really like furry and you feel it. But humans have the same thing, it's just less so. Sorry, were you going to say something?
No, I'm just no.
And so what we do is brush the tongue, and by brushing, I have like it's like a metal copper thing that goes like that, and you just scrape it over the top of it quite gently and just go back and forth, and you'll have almost all the time you will have a layer of like white or greeny or bacteria stuff or food debris on there, and the more you do it, the more you'll notice when it fluctuates. And it's all about becoming in tune with your body, just like the oils allow us to do as well. So if you've got a sore throat, you'll notice there's a massive coating on the tongue. If you've got a cold, you'll notice there's a massive coating on the tongue. So it's actually even going to help your general health, because if you're scraping that off every day, your body's got to deal with less. So that's my first thing I do as soon as I wake up. And also, tongue with bacteria on it is the number one common cause for bad breath. So it's a good one to do. Then what we do, or what I do anyway, is oil pull. So 1 spoon or teaspoon I vary between which ones I want to do, but myrrh is the other one that I forgot to mention, which is like the most awesome oil for oral health. Very expensive one, but it is really nice, and it doesn't taste great either. But the studies on that are like next to none for oral health. So that's a really, really good one. I do that for 20 minutes while I'm getting ready, doing all my things. And then I spit it into the bin because it blocks the sinks, especially in the winter months. And then I use the mouthwash, the doTERRA mouthwash, and I just rinse it around for about 30 seconds. It attaches to all of the oil that was in there, and you can spit that one down the sink. And that's it. That's my oral health routine in the morning. Go about my whole day. And in the evening, I spend a long time cleaning in between my teeth. Well, a long time, probably a minute or two, cleaning in between each of the teeth. And there's a few different ones that you can use. I used to be a big fan of the TP brushes with the metal bits in between them, but I don't like it now because especially your very back teeth, you can poke the gums and make them bleed. And when you make the gums bleed, you're letting bacteria into your blood. And literally only the other day, in fact, we've got a new receptionist, and her boyfriend, I was talking to him, or husband, and he was telling me that he had got a medical condition called endocarditis just from a scale and polish. So that's literally just from, when your hygienist cleans the gums, bad bacteria got into his bloodstream and caused his heart valves to be eaten, and he had to have open heart surgery 2 weeks later, and that was from dentistry, right? So this is how well we have to look about our oral health, because that can happen even if you poke less so because you're not doing the whole mouth, but make leaky gums do not equal goodness at all. They normally equal leaky gut and leaky brain, and then you've got bacteria going to all the places you don't want it to. So the evening, I actually now use little silicone. I think they're called Easy Picks. They're like toothpicks, but they're silicone-y, and they can just go through really easily. And yeah, you can use an oil on them, like Melaleuca or On Guard, and just go between all of the top arch, rinse out, and do all of the bottom arch. Or what I do is use I put the On Guard toothpaste in my mouth with the hydroxyapatite in it. Let's swish it around my mouth before I do it, and then I just push that through each of the teeth, and it's remineralizing my teeth as well. Then once it's done, I put the toothbrush in without putting water on it because it's concentrated then, and you're brushing your teeth whilst doing that, and then spit it out at the end. So I've probably got about 2 to 3 minutes of keeping that doTERRA mouthwash in my mouth to stabilize the oral environment. And then that's it for the oral health routine.
And during the day, like after you eat, like
I rinse with water all the time. So I only drink water pretty much, and all with water with oils in and things like that. But after each meal, the top tip for me is you just put some water in your mouth, swish it around and swallow, because that keeps the balance of the acid neutral.
Yeah. And I know you're mentioning about when we draw blood in our gums, but actually one of the questions that we got through was somebody who recently had an extraction, and she I think it was just yesterday or the day before, and she was asking about how to support healing, how to support her body and her mouth and her gum from overcoming the extraction.
Yeah. So if we just go to oils, you've got to always do the salt water rinses and stuff. And I don't rinse. I don't go swish around with salt water. I hold it there, or tell the patients to hold it there. And then once the extractions, once that's started healing, I give my patients little bottles of On Guard, like the little samples of probably about 10 drops in it. And I just get them to put it on their fingers and dab it on one side of the gum and then dab it on the other side of the gum. And they do that twice a day until it's healed. And you just want the pink gum to have healed over the top. So that's the main thing that I do to support. And that's really around infection, because you don't want something like a dry socket, which is infection within the bone where the tooth's been removed. But the main thing is you don't want to swish anything around, because it's the blood clot that protects that. So if the blood clot comes out, then there's more problems, because it's more prone to the bacteria going in, living in the bone. And then that can get really scary, because then you can have something called a cavitation, which could potentially be living within your jawbone, which is like a chronic infection that leaches into your system, a bit like a root canal, I guess. And it might not cause any problems for some people, but it might for other people. And this is what we've got to take in. It's not one size fits all. It's bespoke, for whoever's being treated.
It's really interesting. It's common, well, I know myself. I've had tooth pulls. My husband's had teeth pulled, and I know many people. And just going back, so we've spoken about a bit about oils, but can you maybe even touch on the importance of, if there's any particular supplements, whether that's,
Um,
you know, probiotics, um, nutritional complexes, like what would be your kind of fundamentals when it comes to supporting teeth or oral
yeah,
health, I should say.
it's really interesting because the PBSS Junior has some really beneficial bacteria in there for oral health, and it's in a sachet, so you put it straight into your mouth anyway. So you can literally just put a bit of water in there and just swish it around before you swallow it, and that's really good at bringing the good bacteria balance up. Um, so yeah, probiotics are another huge thing, but again, it's just bringing the balance into a more dynamic flow rather than being more one-sided. Um, for me, yeah,
So just because you mentioned the just on children,
yeah,
um,
yeah,
there's a lot of mums in here that have different kind of they have different experiences with their kids. Some of them are great for brushing their teeth, some of them aren't. And I know even I'm trying to teach my 1.5-year-old to brush his teeth, and he just like chomps down
yeah,
he
yeah.
won't brush them. Um, but any tips when it comes to, when we're trying to support children? And actually, one of the questions was, what was it? How old can children start using the On Guard toothpaste?
Any age for On Guard toothpaste, absolutely any age, but just use less of it. So if they're really young, you just put like, instead of a pea size amount, you just smear it. It's a very small amount smeared on the toothbrush. Um, I mean, On Guard toothpaste is so pure you can eat it anyway, right? So it's not a bit like, it's not like the fluoride toothpaste where if you have too much, it causes problems in your system. So you have to be more monitored. You have to monitor them on that. And it's. I mean, children are blessed with one thing. Well, one amazing thing, which is amazing amounts of saliva flow. So their teeth are constantly being washed and remineralized. Normally, the problems with kids are when they start getting decay is if they mouth breathe at night because it dries it all out when our saliva flow is already much lower. If they are being nursed at night, because even breast milk, I mean, don't get me wrong, I advise my patients to breastfeed for as long as possible because the arch development and growth that happens. But if we do a lot during the night, there is even a little bit of sugar in there, right? So it can cause something called early childhood caries. It's worse with the formulas and things like that. But and that's, you see the pattern of that as you start seeing the decay on the front teeth where it's coming into the mouth. But again, that depends on mouth. It's all risk factor and what causes more or less. And I'm sure if someone was breastfeeding at night and the little one didn't mouth breathe, there'd probably be no problems because the saliva would wash it all away. But in terms of getting them to do the oral health routine, I always say supervise them and help them out up until probably about 7, 8, usually, because the first big tooth comes through at 6 and they keep them for as long as they can. And that really is the ones that we need to be careful with, especially as they start creeping through the gum because of lots of plaque and stuff gets caught on them. So they'll be the ones behind the biggest baby teeth. So around 6 to 7, be hyper vigilant with those teeth coming through and cleaning them and helping them clean them. Obviously, I always encourage them to do it themselves and then mum or dad check at the end, right? Just to make sure. But it is hard. It's not an easy thing.
And you touched on something there as well, and something that came through as one of the questions is just like the fluoride debate. We hear both sides of it. The importance of having like a fluoride-free toothpaste, and then hear some dentists saying, "Oh, make sure that there is fluoride in your toothpaste because it strengthens your teeth." And one of the questions earlier on was around her child. This woman, she was saying that her children weren't, and that the dentist was recommending to include fluoride as part of their diet or as part of their toothpaste, and she's using the On Guard one, and she prefers the On Guard one. But just interested to hear your thoughts, I suppose, on around fluoride, and if you wouldn't mind sharing those.
Yeah, I've seen both sides of the argument, and I don't recommend fluoride unless someone has got growth decay everywhere and they're just not getting it under control. We can't figure out what's causing it. I mean, the facts are that fluoride is toxic to the human body and we have to detox from it. It's not used in our human system, so it gets deposited in places where we don't want it. but it also strengthens the teeth, more so as a paste, like the varnishes that they do. And if you leave it on for 5 minutes, it integrates into the enamel and causes a super hard layer. Or as you're growing, you have fluoridated water and it's into the actual enamel structure, the fluoride's in there. But again, that's going into the system, so not ideal either. So for me, it's always trying to get to the root cause of what's causing it before we introduce fluoride. And if we're not getting anywhere, then I don't prescribe it. Like some dentists prescribe high volume fluoride, which is like, let's say the supermarket has 1,450 parts per million of fluoride. The high volumes ones can have 2,800 and 5,000 parts per million, which is a lot. If you ingested that thing, you'd probably think it's like toxic. So you have to be really careful. And then they say spit, don't rinse, and that basically means you just leave the paste on the teeth with fluoride to strengthen them. But again, there's more risk of that going into the system then. So yes, it works, but there are other more natural ways to try first. And obviously it's getting to the root cause of it. Is it sugary drinks? Is it fizzy drinks? Is it mouth breathing? Is it grinding the teeth that makes the enamel weak and susceptible to have micro cracks in them to let decay in? There's so many different things. But if you can't get it under control, you could even, before you go to fluoride, try there's something called tooth mousse, which is it has lactose in it, which is a bit annoying, but because some kids I can't recommend it to, but it's got really high volumes of hydroxyapatite in it, and you paste it on a bit like the fluoride paste, and it starts to help remineralize the teeth. But even the doTERRA's got hydroxyapatite in it, which is good, and there's other natural brands that you can do that with. So I mean, the main thing is with kids, trying to get them to leave it on their teeth because they don't always like the taste.
Yeah. So that's good to know. So just even, I suppose, myself, like when the doTERRA, like the way they changed the formula of the toothpaste recently, and I started to understand a little bit about remineralization and all these different things that I wasn't familiar with before. So what is it that's in the doTERRA toothpaste that is really beneficial to us?
The calcium hydroxyapatite, because say this is the nerve inside the tooth. This is the main structure, which is called dentine, and then you have your enamel on top that's really strong. And the enamel is a crystal layer that has 96% inorganic material, so almost like as solid as a crystal, and it's only got 4% porosities in there, which means like water and stuff can get in at 4% of the tissue. Then you have the dentine, which is your root surfaces and underneath the enamel. That's 70%-ish solid and 30% porous, so things more likely can get in there, staining can happen. And obviously your nerve and your blood supply in the middle is just completely hollow. That's just your actual life force of you. And if we're thinking around calcium hydroxyapatite, what that is our enamel is made up of calcium hydroxyapatite. So if we're introducing it into a toothpaste and letting it stay on there, you're influencing your system to try and remineralize or strengthen areas of the tooth. Because in a 24-hour period, our teeth go through areas of demineralization and remineralization, and that fluctuates all the time. And anything that causes them to demineralize, such as eating food, any food, because the bacteria breaks down into acid, drinking acidic things, eating acidic things, fizzy things, they create an environment to make our teeth more susceptible to dissolving, because it's not really, it's the acid in the bacteria. And when they get through that enamel layer, there's tubules direct to the nerve. So then they're small enough to just creep through if there's no outward flow. And because our nerve, for every 24 hours, does a lymphatic flow out of these tubules into the oral environment. And if that's not working, then bacteria can get into it and start causing problems. So the first thing I look at is when someone's got lots of decay is obviously brushing, cleaning, remineralizing, but also nutrition, diet. And the trick is, if in a 24-hour period, you should only be eating for 2 hours of that period. That's because that associated with the remineralizing time after each meal. Any more than that, then your teeth will be more out of balance and not able to mineralize too much. So it's
so if you're picking at packets of nuts and even healthy snacks on the go all the time,
which
kind of like That's something that I would have been taught is like, eat small but regular throughout the day. But is that not good for that's kind of, you're saying
Not
that's,
good for your teeth, but you can obviously hack it in ways that you can drink water afterwards and swish it around to get it back up to that mineralized bit first. But the problem, like the biggest problems I see is when I have kids that are just like raisins, for example, just eating them all day, and they're just like held in their teeth and they're sticky and they get there and they're really like acidic and things like that. And then you wouldn't know that really because you think raisins healthy, right?
yeah, I know, that's it. Exactly. Um, okay, so let me just see now. I think I've gotten through all the main questions. Okay. Okay, really quickly, what are your top three if you were like stranded on a desert island and you could bring three oils with you? What three would you bring?
Wow. Air.
Okay, yeah. For
Yeah.
the about the night breathing or the
Yeah, for breathing in general, I just love air, and I use it's probably that's something else I do in my morning routine. I brush my tongue and then inhale air for about a minute or two, just to clear the sinus to allow me to breathe more clearly through the day. And you'll be fine. You'll find if you do oil pulling as well, it clears all your nasal sinuses and everything, and you spit at the end of it. You're getting rid of this gunk that's just come from nowhere. So sorry, air. I'm diverting again. Is probably my favorite one. It would have to be On Guard, I think. So
yeah,
versatile. And then frankincense.
frankincense. Yeah, they're all good oils. And do you have like any additional one that you bring specifically for dentistry?
Well, On Guard was my plan for that
Okay.
dentistry really, and get some coconut or fractionated coconut oil. Then you're winning, aren't you, from the doTERRA collection?
Brilliant. Okay, and then just really quickly, um, how does like what's your thoughts on like gut health when it comes to your teeth? Does it directly influence it or is it over time that if you've got like any digestive problems or if you have problems with your gut, like when you start to see that transpire through to your oral health?
I mean, the question is, which way does it start? Because if you think about the mouth and the bacteria that live in the mouth, and if you've got a negative environment of bacteria, you swallow 2,500 times a day. So you're swallowing that bacteria. And yes, some of it will be killed in the stomach acid, but some of it's going to go through because otherwise, how else would it be there, right? In our stomach. And if that's constantly being drip fed, it will create a dysbiosis in the small intestine or even in the colon if it's gone through that and gone to the other way. And for me, if you have leaky gums in your mouth, it's the same mucosa as your stomach, as your small intestine, large intestine. So you will certainly have leaky gut, which is linked to so many autoimmune conditions and stuff, isn't it? So, and even IBS and everything. So I think that it's almost symbiotic. That they're literally linked together, and it's chicken and the egg for me. Which one came first? But
Yeah.
but even helping my patients just in the oral environment, that you watch their symptoms holistically change from their gut over the years. It's fantastic.
Actually, just when you mentioned autoimmune, somebody asked a question about how to support lupus in the mouth. If you
Yes.
have any recommendations that you could suggest, I know that it's not very, I know it's very specific to that person, but even just any kind of general advice or just any tips that you can give in supporting that.
Yeah, lichen planus, lupus, any ones that create ulcers in the mouth or anything like that. Really, obviously, there's two ways of looking at it. If you're going to put a plaster on it just to get you through that phase of flare up, which is using things like On Guard mouthwash, On Guard on the areas that are sore. But if you want to try and get to the root cause of it and oil pulling and stuff like that, then usually it's to do with metals in the mouth because people are allergic to metals and it can cause direct influence on the mucosa around it. Like, so for example, in Sweden, if someone's got these big like lesions in the mouth, the first thing they do is remove all metals. That's their first line of treatment in the mouth. And because if it's affecting the gums like that, it's getting into your system and could be causing, because that is an inflammatory reaction to something that's not meant to be in your system. There's something crazy as well that 20% of people that have titanium implants into their jaw in 10 years will be allergic to that or have some kind of sensitivity to that. So then the body will start attacking that, which is going to be dripping into your body each day as well. So yeah, I try and stay away from all metals if I can, but obviously that's not always possible. And if there's been long-standing metals in the mouth, not mercury, I always remove that, but crowns, for example, that are less invasive metals, and it's risking devitalizing and losing a tooth, then I'd probably leave it there in case. But as much as I can, I try and support my patients to remove them from their system.
And you just mentioned ulcers. I think I know we're not going through the chat box yet, but I just saw something pop up. Somebody said ulcers
Yeah.
in general. So On Guard applying it just topically, just direct.
Yeah, to manage the pain, On Guard, clove, and then using supplements like LLV, because ulcers can be stress, yes, but when the thing that I look at is when we're stressed, everything that's close to that symptomatic threshold comes up. So obviously there's other stuff in your tank that you need to be clearing and getting rid of. So that's keeping you on the edge of having ulcers. And ulcers can be viral, yeah, they can be bacterial, but they can also be iron, folate, B vitamin deficiencies as well. So there's lots of different things that could influence that. But to manage the pain, oil pulling and On Guard are normally the ones.
Brilliant. Thank you for that. I might just go through some of the questions that are just here.
Yeah, go for it.
So Sandra says, so excited to see you here. Let me see. Okay, so Cara says, this is wonderful, guys. I work in an orthodontist clinic and I'm hoping this will be recorded so I can share it with my boss next week. We use
Oh, no.
oils in the clinic like On Guard, Copaiba, Balance, and frankincense.
Amazing.
Let me see. And then she said, what I meant is that we diffuse the oils, not just there for using topically. Okay. Sandra asked any ways to stop grinding. We kind of touched on that. Jill asked about ulcers. What do you recommend for sensitive teeth?
The actual, hit and miss, but like 50% of patients that use the On Guard toothpaste can get a reduction in sensitivity, which is really fascinating. Otherwise, the tooth mousse or calcium hydroxyapatite solutions or pastes that you can just put onto those sensitive areas. The sensitivity, again, coming back to my clenching and grinding, is to do with clenching and grinding, usually where the gums recede, because of the pressure you're putting on the teeth, and those ligaments say, I can't hold on to this tooth anymore, and it recedes and gives up or breaks because of the pressure is causing the cutoff to blood supply to the periodontal ligament. That's what I'm trying to look for.
It's great to know all that, just even about like the remineralization that happens with the On Guard toothpaste. It's so good to know. And actually, Sandra's asked a great question, which actually I was like, I've been meaning to interrupt you a couple of times, going, I need to ask a bit more on that. She's asked, how do you recommend for somebody to get out of that habit of mouth breathing? Like, where do you even begin with that?
Check that they can breathe through their nose first is a good starting place.
And as in that they're not congested or something like that, is that what you mean?
Yeah, because they could have nasal polyps. They could have like enlarged adenoid tonsils, which are at the top and back of the nose. And do some like Buteyko breathing is a really good practice to just focus on nasal breathing. And then once we know you can nasal breathe, then it's about removing the factors that make it harder to. So tongue, because if your tongue's living up here, you can't mouth breathe.
Yeah.
So you have to nasal breathe. And actually, what's crazy is the more you mouth breathe, the more your nose blocks. The more you nasal breathe, the easier it gets. Because it's to do with the biochemistry and the oxygen in the system and the carbon dioxide and nitric oxide and all of those levels. So if you can get it to a place where you can actually breathe through your nose all the time, once we've checked, it's just about removing the habit. But tongue to the roof of the mouth is the easiest thing for me, and keeping the lips together, because then when you can get your tongue right to the roof of the mouth, it feels like it opens up the nose. It's a really strange sensation. I can't really describe it.
Even if we all try it now, just even putting their like, I'm trying it now, I'm like, oh gosh, I see what you mean.
It's
And
amazing.
I suppose it's good even like when we think about like our meditation and doing deep
Yes.
breathing exercises, and it's all about in through the nose, out through the mouth, in through the nose, out through the mouth, and I suppose those types of, amazing rituals that are so good for you from like a mental health standpoint, are,
Yeah, yeah.
I guess, helping support, when it comes to oral health as well, which is great. Um, okay, I'm going to just open up Facebook here really quickly and just see if anyone has any questions. So, same questions actually coming through here. Louise is asking, how do you stop grinding and clenching? Um,
That's easier. Like, so either it's the tongue position, it's all about the airway and sleeping. So either you need to build up and move this jaw downwards and forwards to open up the structure, practice nasal breathing, mouth taping, and posture. And sleeping, here's a really interesting one, sleeping on something that doesn't put your head like that. So not a big pillow. Big pillow is not good. You want a flattish pillow.
so neck support, really,
Yeah,
really good.
exactly.
Okay.
Exactly.
Um, let me see. They're all just, just saying great tip, thank you. I don't know what specifically because they're all kind of over the course of the last hour. Never knew about oil pulling. Brilliant. I'm so glad that we went into that. It's always great because, it doesn't matter where anyone is on their journey. There's always
No,
going to be tips and value and different things that they can pick up. Would
absolutely.
Let me see. I think that's it. Actually, the very last question is, can you recommend anything to support the symptoms of? I'm gonna absolutely hammer this word. Paro, parodont, parodontasis. Oh my gosh.
I think it's spelt wrong because I'm thinking it's periodontitis is what
Okay.
it's meant to be, which is
I'm like,
advanced
I
gum
don't know
disease.
again. It's which?
It's
It's which?
advanced gum disease where there's
Okay.
actually bone loss, so the teeth are becoming a bit more wobbly, long in the tooth, like we mentioned earlier.
Okay.
And it would be all those things we touched upon earlier. So creating a nice environment for the good bacteria to live in your mouth, which is like removing metals, stopping mouth breathing, oil pulling, and then using a professional to clean underneath the gums with the best technology that they can to, and even if it's not the best technology they can, just getting rid of those things that like the plaque that's stuck to the teeth or the calculus that's stuck to the teeth to stop the inflammation. And then then what happens then after like a period of 3 months, the gums then tighten and they're not as inflamed, and then it should just stop. They'll never grow back unless you have like gum recontouring surgery, but they will strengthen so it doesn't progress any further, is usually the aim to start with anyway.
Brilliant. Thank you for that. I think I've gone through all the questions. We've gone way over. I'm so like as in, I'm so grateful for you giving up your evening, like you're full time in your clinic, and then you're coming home, getting your dinner in, and then jumping onto Zoom with us. So we're all just so thrilled, and thank you so much for all your wisdom and all your insights. It was so great, and I'll definitely be like as in all of us as a family bringing in so many different changes.
Oh
So
well, yeah, if you need any help, Alison, just reach out. And yeah, if anyone wants to follow me and ask questions, they can do as well.
and so would you mind just I'm gonna pop it into the chat here. Is it remind me of your Instagram handle? I think you've just frozen on me. Or maybe it's not me. I'm
I can
actually
he-
just
I can hear you, Alison, but
okay. I wonder, I'm just gonna open up his Instagram here and I'm gonna tell everyone what it is.
Oh wait, we're
Seb,
back.
are you there? Okay, so Seb's Instagram handle is biological underscore dentist. Dr. Seb.
Can you pop that in the chat? That would be great.
Yeah, no problem.
Thank you so much, guys. That was just amazing, really.
I hope.
Welcome. Sorry, I'm back.
Oh, brilliant! I was like, gosh, I'm just sharing your Instagram handle, Seb. Biological underscore dentist on Instagram.
Thanks, Alison. Thank you.
I don't know, Seb, if we've gone back. Do we? Gallery. Let me just see.
thank you so much.
Oh, there you are. Are you there? Oh, you are great.
About my internet's decided to drop out.
Well, good timing at the very end. So we managed to
Good.
get everything in. Thanks a million. Really appreciate it. Thanks for joining
So
us.
well. Thank you.
Thanks,
Everyone.
everyone.
Have a lovely. Bye.
Thank you.
Bye. Thanks
Bye.
so much.